Welcome to the EthnoMed podcast, a community voice in the clinic. My name is Dr. Duncan Reed, a physician in the International Medicine Clinic at Harborview Medical Center and medical director of EthnoMed, a web resource for providers and patients with information for cross-cultural care. Today, we are continuing our interview series called Provider Pulse, where we elevate diverse voices from across healthcare fields to learn the paths people took to their current roles in healthcare and how their cross-cultural experiences have helped them provide more informed care to diverse patients. Whether you are an undergraduate student considering a career in healthcare, a practicing health professional, or a member of the community, these conversations are for you.
I think I always was very interested in the medical field. I think the idea that was always presented to me was to just go and be a doctor. I just remember being very scared. I don't want to let my parents down because I think your parents come to this country for a reason. 9 times out of 10, it's for the kids. You watch them sacrifice their dreams, you watch them sacrifice their aspirations, and then it's like, okay, well, it's on me. I'm very grateful for that female mentorship. They know what it's like to be a woman in this field. So it's really helpful to have that kind of support behind you. It's like knowing that you have somebody there, it's a very warm feeling. And then for me, it's like I want to be able to give that back as well.
On today's episode, we are featuring a discussion with Natalya Sarkisova, an epidemiologist with the TB control program at Seattle King County Public Health. She reflects on her identity as an immigrant from Russia, the internalized pressure to succeed often felt by children of immigrants, and the pivotal role that female mentorship played in shaping her path toward a career in epidemiology and public health.
Hi, I'm Natalya Sarkisova, and I'm an epidemiologist with the TB control clinic in King County. I joined the community prevention unit about 6-ish months ago. I was born in Moscow, Russia, and came to the States. We moved to Rhode Island first when I was 2 years old. My dad was on a student visa, so he came to the States a bit before my mom and I did. After my dad graduated from grad school, we moved to New York for about 3 years, and then eventually landed our way into Washington.
How old were you when you came to Washington?
I think 9 or 10. We first made a pit stop in Bellevue and then eventually Redmond. And that's where we've been since.
How is your Russian?
Fluent. Pretty good, yeah.
How was middle school, high school? Did you feel like an outsider coming from an immigrant family?
Not so much. I think because I moved here when I was quite young, picked up English very young. It's fun to be bilingual. I don't think fitting in that sense was too much of an issue.
So it sounds like you identify as American.
I identify as Russian.
Oh, really? So even despite all these things, being able to blend in, you still have an identity that's tied back to the homeland?
Yeah. I think mostly because it took us a very long time to get our citizenship, and being in that process, watching my parents go through it was tough. It took much longer than I noticed with some of the other kids. I guess Russian American, sure, we've spent our entire lives here, but it was just a hard situation to go through for sure.
Do you feel like you have a good understanding of your heritage and your Russian background?
So we're actually also Armenian. So growing up, we went back quite regularly. Both of sets of my grandparents from my mom and my dad's side lived there. And then we have one aunt and then friends of family and everything. So we have a lot of people over there, and we would visit almost every 2 years. My grandparents really drilled it into my parents' head to teach us about the culture from both sides, both the Armenian and the Russian. Although I'm getting a bit more in touch with the Armenian side, I would say within the last 5-ish years or so. As far as the lineage goes back, everybody was born in Armenia. My mom's grandpa, one of them was born in Armenia. My dad's dad, grandpa, was born in Armenia. My mom was born in Moscow. My dad was born in Azerbaijan. So eventually they all made their way from Armenia to Russia and or Azerbaijan or Georgia.
How about your parents? What fields were they in?
So my dad, main reason we moved to the States, he got his student visa and he was in grad school for theoretical physics. So he got his PhD in that, eventually went down the engineering route because it was easier to get a job in that as an immigrant, especially with the background he has. My mom had a degree in family education. So she worked with the tiny humans, as I like to call them. I think pre-K is what she worked with. And then eventually she actually went back to school to become an esthetician and a massage therapist. When I was in high school, that's something she was very interested in.
So how was middle school, high school? What were you thinking about? Did you have an idea of what you were going to study?
I think I always was very interested in the medical field. I think the idea that was always presented to me was to just go and be a doctor. Doctor was like the ultimate highlighted goal. I think the trope is true for immigrant families. You become a doctor, you become a lawyer, you become one of those. But I really always enjoyed my science classes. I do remember struggling a bit. So I just had to work a lot harder, even though it was tough. Those science classes were tough for me, but I always really, really enjoyed them. And then I remember taking my first anatomy class in high school and I was like, whoa, the human body is so cool. This is so fun. So I'm going to go to college. I want to become a pre-med. And then, life happened. So I went to the University of Oregon and I didn't tell my parents I was applying there. I really wanted to move out and was like, all right, find a way to pay for it. Okay, let me just apply to as many scholarships as I can. And I love the school. I took all of the sciencey classes. And what was interesting, now that I think back on it, it was really the only option. Like being a doctor was the only option that was offered by so many professors, so many guidance counselors. And I was like, I guess this is what I'm going to do. And then I remember OChem really got me. And I distinctly remember 3 specific breakdowns I had. One was over OChem. I was like, I'm never getting into medical school. The second breakdown I had was when I was applying and I was like, this is so much money. This is so much time. Like, what am I doing? And as the eldest immigrant daughter, my parents gave me no mercy with that, really. They were like, you have to apply. You have to see what happens. This is what you're going to do. And I was like, okay. And I applied and I got rejected. And I was like, oh my God, I don't know what to do next. And then it was interesting. I feel like for the med school route, people make the decisions for you, like on what you have to do next. And I feel like you never really get a chance to breathe and think about like, well, okay, what am I actually interested in within the medical field? And how do I get there without becoming a doctor? Because surely that's not the only option, but that's how it was presented. And then somebody spouted the word research at me. And I was like, okay, I guess that's my next route. Let me see what happens.
So you were there at the University of Oregon. You're the oldest child. You didn't even tell your parents that you were applying there. You're obviously very resourceful. You got a lot of your own funding and you were doing your own thing. But even despite your independent streak, you feel like going into medicine is your only option. Like, this is what I'm expected to do. And you went through all these pre-med courses. They're tough. And then you even went and applied to all of these medical schools. You went through that whole process.
Took the MCAT. I just remember being very scared. I don't want to let my parents down because I think your parents come to this country for a reason. 9 times out of 10, it's for the kids. You watch them sacrifice their dreams. You watch them sacrifice their aspirations. And then it's like, okay, well, it's on me. And I think economic reasons are a really big deal too. They want you to come out of school making a lot of money. What is the most high paying job? How do you get there so quickly? So work as hard as you possibly can through high school, through college, get a good job, and then you're set for life. The way it was presented to me was very linear. I didn't think I would hit so many bumps in the road.
And then how did you discover public health or research?
So I graduated in 2016 and then took some time off, applied, which is, I remember, very hard. And then got a job at Children's Hospital Los Angeles doing research in sports medicine. So I was a research assistant. And then I was like, okay, I'm going to apply for med school again after I get some research under my belt. Again, it didn't work out. And one of my mentors, who has an MPH, she was like, have you considered public health? That seems to be the route you're leaning towards. I was like, I love public health and so I want to be a doctor. Because for me, I remember being very interested in outcomes of kids who would undergo various procedures, whether they were able to get back to their sports quicker. I was looking at insurance claims. I was looking at things from an economic standpoint. And I was like, these kids who don't have the best insurance, their mobility tests aren't as great or things like that. They were just having poor outcomes. And I was like, I don't know, this is weird to me. And then my mentor at the time was like, you should consider public health because it seems like you're really interested about the people. And I was like, isn't that what medicine is? She's like, yes, but we only get to focus on one person at a time sometimes, but it seems like you really want to focus on the public. Oh, that's weird. Okay. So then she helped me research a lot of schools and I'm very grateful for that female mentorship, especially because I feel like our field is quite male dominated sometimes. So for me, I also didn't realize how important female mentorship was. And I found her and she helped me and then moved to Boston after about 2 years in LA.
What is it about female mentorship that is so important to you? It
has always felt like a very safe place to me because these women at that point in their stage in career, they've gone through every single obstacle possible. They've experienced sexism, they've experienced misogyny. They know what it's like to be a woman in this field. So it's really helpful to have that kind of support behind you. I don't want to say it feels like a protective layer, but it's like knowing that you have somebody there. It's a very warm feeling. And then for me, it's like, I want to be able to give that back as well. I think it's just kind of like having female friends. It's a different type of experience than you would have with a male mentor, I would say.
How did you find this mentor?
I worked with her on one project, and then she was like, do you want to work with me on a bunch of other ones? Because she was also very interested in gender disparities within pediatric orthopedics and the orthopedic surgeon world in general. I was like, oh, wow, this is really cool. And again, I never thought about like gender disparities, race disparities when I was in undergrad because I went to a predominantly white school and these things weren't ever talked about. It formed very organically and very naturally. At one point, I was like, I feel very comfortable talking to you about a lot of things. Like we'd catch up on life and then I'd be like, well, let's talk about like work. And then would you mind helping me out? I'm, not exactly sure what field I want to go in. And then eventually she helped me out with that.
Did you ever get an insight into what was motivating her to be your mentor?
She said something to me once. So I remember helping her with this event called the Perry Initiative, which is the national program that helps young women in high school consider a career in any sort of STEM field, specifically bioengineering. And I remember her and the other women orthopedic surgeons in our department would host this every year, and they would teach the kids procedures on fake bones, basically. And she was like, I think women will eventually rule the world, but she said we need to be better about helping each other.
Did your mentor understand your immigrant experience as well?
I didn't really go too much into that. I think to me, that experience didn't really hit until grad school, honestly. I didn't really think about being an immigrant as a thing, really. It was just like I was just moseying through life and I'm trying to figure out what to do next. And then I was like, oh, the immigrant experience actually, I think, did a bit of a number on me.
Mentorship is so important for undergrads too, and thinking about how to develop them and how we act as one. But it sounds like you encountered someone that was very intentionally trying to help others. And I think that's something that we all can do. You already had this very independent streak where you went to Oregon, you went down to Los Angeles doing your own thing, and then that's where you're thinking of a master's in public health. What did you do your undergrad in?
I did my undergrad in human physiology.
And that's when you were talking about anatomy and thinking about this medical path. So then there's this possibility of doing an MPH. What were the next steps?
First of all, applying to a different program seemed very daunting. And then telling my parents that I did not want to do medical school. Actually, okay, again, I did not tell my parents I was applying to grad school for a public health degree. Number one, because they still ask what it is that I do. And they still ask what public health is. I think my dad now has my title. I didn't really tell anybody I was applying again to a different program because I was scared of getting rejected again and then having to tell people again that, I got rejected from a different program. So I was very scared. But when I was talking to my mentor, I was like, do I just apply everywhere? She's like, no, don't do that. You're not applying to medical schools. If it doesn't work out, it's okay. Then you'll just keep doing research. And I was like, oh man, then do I consider a PhD? So I was all over the place. But I remember looking into Boston, Emory, UCLA, and UW. And then I remember getting an email from Boston and they said that I got in and I was flabbergasted, to say the least. And I was so excited. I've always wanted to live in Boston. I really liked the different classes that they had offered. And I did a deep dive into these public health schools and I was like, wow, this is so cool. Everything that they're doing, the research that they're doing. So then I packed up and moved from LA to Boston. 2019, and then finished out my master's of public health during COVID.
So this is great news. But can I go back to that rejection? So you were rejected the first time from medical schools, and then were rejected the second time. You're talking about having to share that news with your family. How did it feel, and how did you deal with that? What impact did it have on your esteem and your life at that time?
I was so young at the time. So looking back now, I wish I could shake myself, feel like it's going to be okay. But at the time, I was really embarrassed. I was just kind of shocked. I thought I would get in somewhere. And I remember having this feeling of what am I supposed to do better? What else can I do to try to get in? And I was so tired. I had spent so much money applying to these schools. And I was like, oh my God, what am I going to do? And then, I think it's safe to say my parents were a little bummed out or disappointed. Yeah, I think it took a very long time to get over that hump. Even when I moved to Boston, I was like, well, maybe I should try again after I get my master's of public health. That was before I realized how much I was really, really interested in public health and how much I really love the field. But it was hard. Like it was definitely a blow to the self-esteem. I was like, well, if I can't get into these schools, let's just say I'm going to do really well in public health. But I think it honestly, it ended up working out for the best. I love the people that I met. Was it fun to go to grad school during a pandemic? No, but I think it added to the experience.
And what did you end up really enjoying about public health?
I remember on our first day, the dean of the school gave us a huge speech. And he was like, you're in this program for a reason because, again, you are more interested in the community as a whole rather than one person individually, which so often happens in medicine. There were so many different characteristics that went into it. I learned about social determinants of health. And one of my favorite classes I remember was taking this GIS course, so mapping. And there were just so many things that went into it. And then once COVID hit, it was like, okay, like all hands on deck. So at that time, I was doing epi and biostats. So they put us in the data center. And then we also got put into working with the actual public. So we did a lot of contact tracing. We did a lot of working with different organizations around in Boston. So it felt so hands on. And it was just a real team effort, which I really, really enjoyed. And you got to really work your brain in so many different ways. It wasn't just like a one track all type of situation. The people were so cool too.
It makes sense that you guys were on the front lines of figuring out what to do with this health response. And it sounds like you really liked the people you were working with. And then how did you end up in Seattle?
I'd always said I wanted to come back to Seattle. I never knew when, but after I graduated, it was 2021, I was like, I think I'm ready to go back. Like I miss being with my closest friends, miss the Pacific Northwest. So I was really excited to come back.
What's your job now?
I'm an epidemiologist now.
What do you do?
Gosh, right now, what do we do? Overarching theme is data management, quality control of that data. TB, everybody has to report it to the state. So we overhaul this big data management and we put in as many data variables into this online data source. We do surveillance. So if there's some sort of outbreak or cluster, we go to the site. If it's a highly infectious type of situation, we go to the site, we figure out who needs to be tested. We are in track of the genotyping. So we wear a lot of hats. And then also the side mini projects that the MDs want us to do.
What's next for you? You haven't been here that long now.
I don't know. I guess, just keep doing all the epi things. I guess if we're looking into the future, I would honestly love to move abroad and do public health abroad. You don't know necessarily what that would look like, but I guess it always goes back to research, but applied research and behavioral interventions. And I've always really been interested in maternal health. So I'd love to get into that field. I think camaraderie is very important. In the end, a job is just a job. But for me, some of the most fun parts is every Thursday we have our ethnomed meeting. And that's so much fun for me. Seeing Catherine and our other friends, in the office. I think along the way, it was so interesting for me because I saw it work out for so many people. And again, I don't know what hardships they went through their life up until that point, but it just seemed quite easy for them. But then now that I think back with it, socioeconomically, they were at an advantage compared to I was. Gender roles at an advantage. You eventually meet your people and they will help you. They will help you get to where you want to be. And I think that kind of support is it's an incredible feeling to have, especially in this field.
What advice do you have for people who are looking for mentors? There are all these undergraduates. They're doing all the hard work. They're taking their classes, taking all their prerequisites. But then the question they have is, how do you meet the people that are going to help you figure out what you're going to do for a career?
Well, don't listen to your guidance counselor, first of all. I don't know if it was just my experience or what the situation was, but they'll just put you down if I'm going to speak quite frankly. Again, for me, I was very, very lucky to have found the woman that I found. I applied to this job in Los Angeles kind of on a whim, and I didn't realize that I needed that kind of support. But when I found her, I was eternally grateful. And then a really important thing for me moving forward was to find that same kind of mentorship. So it really just takes that one person, whether it happens to fall in your lap or, seek it out. So if there's like a professor you really like, bug them to no end. Like, I think there's a reason that they become professors. I think it's because they do like students and they like teaching, and it's okay to be scared. But once you find one person, it will really just shape like how you start to view other important people in your life. So I was like, okay, I have this one woman, I got to find somebody else just like this in grad school. And I did. And then I just kind of kept searching for that. So when I was applying for jobs right out of grad school, I was again, female mentorship to me is a very important thing. So I was like, really? Like, who am I going to be working with? And these are the questions that you ask, especially as you go through job hunting. And so I found one right after grad school, and now I'm here in public health. And just bug your professors, bug the people that you really like. I think that's the biggest thing, especially as an undergrad. You're 20 years old. Like, it's scary, but yeah, they're more willing than you think.
Thank you so much for your time today, Natalya. We hope this episode has provided insights that help listeners better understand cross-cultural perspectives. In today's conversation, Natalya Sarkisova discussed her immigrant identity, overcoming rejection, and ultimately finding a career in public health through strong female mentorship. We will be continuing our Provider Pulse series with more interviews featuring healthcare professionals whose life journeys have deepened their ability to deliver effective, culturally responsive care. Here's a preview from Catherine Evangelista, our guest on the next episode.
I think immigrant families always just go to engineering, doctor, or nursing. So that was the only choices that we had. We didn't have any other choice. But ever since I was young, I was always really into art. I like drawing, painting, any kind of form of art, and eventually photography. That was very quickly discouraged to pursue something in the arts. To be honest, when I was thinking about public health and got in, I was doing the program, I felt imposter syndrome because this is something I just found, and I didn't feel like I was as passionate about it as my fellow students. And sometimes I do still feel like that. Sometimes I still feel like the imposter syndrome is really overwhelming because this wasn't something that I sought out. I love it. I love what I do, but it's not like a burning passion that other people feel.
Be sure to visit our website at ethnomed.org for additional resources. Also follow us on YouTube and Instagram at ethnomedUW and on LinkedIn. Thank you.